Leading off the show, our first guest is an arthritis researcher for creaky joints. Sometimes it happens to you, right? You can hear it. Also does research for Global Healthy Living Foundation. And joining us for a look at his work and to spread information about health, we welcome Ben Noel to the show. Ben, we welcome you.
Thanks, Bob. It's great to be here on Open.
Yes, and we heard a lot about some of the work that you do, your research and everything. Tell us first, tell us about what you do.
Sure, happy to. First of all, I feel, Bob, like I need to drop my voice a couple registers down to match yours. It's great to be with someone with a radio personality voice. So I manage all of our research activities with Creaky Joints and the Global Healthy Living Foundation. And specifically, I manage all of our patient-centered research. What that means is it's the kind of research that engages patients not just as passive human subjects or participants in research, but people who really get to participate in the design, the implementation, and the dissemination or the spreading the results, learning about the information that we learn from arthritis research. Creaky Joints is an amazing community. It's the go-to source for more than 100,000 patients and their families worldwide for arthritis, for support, education, advocacy, and now research as well.
If you have creaky joints, does that mean that you're on the verge of getting arthritis, or you have arthritis, or?
It's a good question. So I guess that goes to the question of what is exactly arthritis. There's actually many different forms of arthritis.
Sure.
The most common form is called osteoarthritis. And I suppose you might think of that as having creaky joints. It's a sort of deterioration that happens to many of us over time, where it's a wearing down of the joint and the cartilage there. But then there's also inflammatory forms of arthritis, things caused by synovitis, or when the synovial fluid, the lining in the joints, gets red, swollen, inflamed, hot. Things like rheumatoid arthritis, a lot of people know about, and that strikes more women than men, and actually can often hit people in the prime of their life, 35 to 55 years old.
I can hear Daily Dose FM. What do you think? So who do you serve? Who are some of the people? How do they get involved in this research of yours?
That's a great question. So we really serve, and I personally serve the arthritis patients around the country and around the world. We're located right here in New York. Our office is in Nyack, Upper Nyack, so just north of the city. I'm a proud Harlem resident. I've been there about 10 years. So we serve, people not only locally, but nationally and even internationally as well. And in particular, people who are living with these chronic conditions and their caregivers.
Is there a certain age where you begin to get arthritis, or?
It depends. So for people with the more inflammatory forms of arthritis, it can affect people even when they're children. For the most part, rheumatoid arthritis affects people in middle age. Osteoarthritis we think of as being more of an older person's disease. As we get older, our risk of getting osteoarthritis, or OA, goes up. And people can find out more about creaky joints by going to our website, to the creakyjoints.org, creakyjoints.org website, or give us a call, give me a call, and I'll tell you our phone number later.
Ben, is there some things that we can do in order to stem it or head it off, or get ahead of the game there?
That's a great question. In some ways, it's counterintuitive. Some people think like, I gotta slow down. I need to not do as much, and so they can be scared off by things like exercise. But there's a phrase in the arthritis community called "motion is the lotion." So it seems counterintuitive, but actually movement, exercise, even jogging, actually can improve symptoms for many types of arthritis. Stretching, absolutely.
Lubricate those joints. Get moving.
But I think most importantly, people need to get in touch with their doctor, to talk to their primary care provider. If they have a rheumatologist, if they have an inflammatory form of arthritis, to work closely with their doctor to make the decisions that make sense for their particular case.
Let's talk about the importance of the work that you do. First of all, how did you get involved in it, and why is it so important?
So my background is as a healthcare social worker. I was a medical social worker working in hospital with patients for many years. And working alongside doctors and working alongside patients in that kind of a healthcare setting, you see that actually patients bring so much wisdom to health, right? To their own healthcare. They're really their own, their own best doctor in many cases. And so when I got my PhD and started focusing in on research, in arthritis research in particular, I was really excited to be able to bring that kind of patient, clinician, or doctor relationship into the work that I do, into the research work, because I think research is better when patients are involved, when patients are leaders and partners in designing research and getting the word out about research and understanding the results. And so the project that we're working on right now is called Better Said, and this is for joint replacement, actually hip and knee joint replacement. And we believe that joint replacement research would be better said when patients are involved.
Yeah, they're involved, they've been through it, they know, and you could put those two, you could put the academic and the practical experience together. The practical experience from the patient having to go through it, and then all the things that you've learned through your research.
Exactly.
Yes.
That's right. Because patients have a lot of questions. They have decisions that they've had to make along the way, especially for something as big as a joint replacement, hip replacement or knee replacement. It's a big deal.
It is.
You go under anesthesia. It takes a while to recover. There can be complications, and so you want to get some answers. You want to be well informed going in for those kinds of procedures. They certainly help people, and I've talked to a lot of people who say, I don't know why I didn't do this sooner. My life is so much better. I have more mobility and function.
A lot of people go through it for years thinking that the body will take over and it will heal itself. And sometimes it will in some cases, but when enough is enough, you have to go and try to find out the necessary steps to take in order to get the job done.
That's right.
Operation, knee replacement, hip replacement.
Exactly. And there's a lot of questions that are a little bit mysterious or kind of behind the curtain for patients. For example, which particular device is being used, because there's doctors have a choice actually of which particular knee or hip mechanics they use, the sort of the metal or the porcelain joint or the plastic joint that goes into the body. That's something that patients don't really ask about or think about, but it's something that they should be concerned with, because most of them work out great. Occasionally there are problems with the devices themselves. So we want patients to be informed. We want to get them engaged in asking those kinds of questions and being part of the research to study what does work best.
Sure, and I'm sure a patient wants to know, I want the best, give me the Mercedes-Benz or the Porsche. Give me something that, if you take something out, put something in that works just as well or better.
That's right. And so those are the kinds of decisions that doctors often make, and sometimes they talk to the patient about it, but not all the time.
And finally, what advice would you give to people who are more or less suffering or have a squeaky joint or need a knee replacement?
Well, right now our project, we have a couple ways to get involved. So I mentioned creakyjoints.org. We have arthritispower.org, which is a research initiative. And then we have something called Better Said, roundtables that we'd like to invite people to come to in New York on Thursday, September 22nd. I hope they'll come, people who are candidates for joint replacement or who have had a hip or knee joint replacement. We need them. We need patients to come talk to us, come talk to doctors, and share their thoughts, what's important to them.
Ben, where can they go for more information on this?
So they can call us at 845-348-0400. They can also go to creakyjoints.org, to our website, or just Google Creaky Joints and Better Said, and it'll come up to the information page.
Give a big round of applause, everybody. Ben Noel, Director of Patient-Centered Research, Creaky Joints Centered Research for Global Healthy Living Foundation. Thank you so much.
Thank you, Bob.
Is there a number to call, by the way?
Yes.
Well, who could they call?
845-348-0400.
Say it one more time.
845-348-0400.
Thank you. I'm going to call you a
Thank you,
doctor
Bob.
anyway, Doc.